Hello and welcome back to 5 Minute Sickle Cell Lessons. My name is Marissa Kors. I'm your fifth generation sickle cell patient advocate, and educator. Today, rather this week, our topics come from Eric, a mutual here in the CPP community. Thank you, Eric, for all of your questions. And this will be lesson 14C. Eric would like to know, outside of pain management, what else can be used to manage the sickle cell pain, or any other vaso-occlusive event. So here we have it. It's our nice little chart, which of course you already know. Boom, came out of the book. Go get it. It's on Amazon. You're welcome. No, seriously, doctors, nurses, patients, caregivers, please go get the book. Okay, so let's start. They've broken it down here in these cute little terms, so I just figure, why not share them? I'm gonna let God use me. Supportive management. Management intended to maintain the essential requirements for good health, such as a balanced diet, sleep, hydration, folic acid supplementation, and regular follow-ups. So, basically, eat right. Sickle cell patients, we tend to be somewhat what my doctor calls nomadic sleepers. That means that we sleep but like 2 to 4 hour intervals throughout the day. That's kind of our default button, unless we're in school or we have jobs that force us into a schedule. But for the most part, yeah, our sleeping habits are crazy. They can be fixed, though. Turn off the phone, turn off the TV, read a book before you go to bed. Some people take melatonin. I mean, there are ways. Symptomatic management. Management target to alleviate the symptoms of the disease as they occur, including blood transfusion, analgesics for pain, and antibiotics for infections, among others. So basically, symptomatic management is speaking to your pain crises for the most part. Blood transfusion, you also have red blood cell exchange. Your pain medications, which can range from Norcos all the way up to our IV pain meds. Obviously, if you have an infection, antibiotics, ulcers, things of that nature, you're going to get antibiotics, topical creams, and like a wound vac. Okay. When I was a little girl, they used to put us in whirlpool therapy. It was not the smartest idea. I'll do another video on that another time, but thank God they stopped that. All right, moving on. Preventative. This approach is to prevent the occurrence of complications of the disease. This includes interventions such as vaccination, avoidance of stressful situations, fetal hemoglobin induction with hydroxyurea or other agents, and transfusion to prevent the recurrences of stroke. Okay, so basically what it's saying here is you can take your hydroxyurea, your Indari, your Adecveo, and voxelotor. I just like saying it that way. Folic acid. These are the medications that are sickle cell treatments. They're approved. They're either pills that you take every day or an infusion that you do once a month or so. Same with the blood transfusion or red blood cell exchange. You can do those only when in hospital, or you can be in a program where you do them once a month. I've never been in an exchange program. And basically, yeah, try to stay away from the stress. Stressful situations are not our friends. Stress is not our friend. Our bodies feed off of stress, and that stress then is turned into a whole lot of pain and frustration. Okay. Abortive management. The major purpose of this approach is to abort painful crises, thus preventing them from worsening or precipitating other complications. I'm not quite sure what they want us to use, so I'm going to skip that one. And last but not least, curative therapy. This is the ultimate goal of all inherited disorders. Sickle cell, well, basically, sickle cell has been allowed to attempt this via stem cell transplant, gene therapy, and as you all know, or later last year, I guess, they dropped the, what was it, earlier this year? I can't remember. But they dropped FDA approved 2 curative treatments for sickle cell with price tags of $2 to $3 million a piece. I will be doing a video on those later in the week, most likely for next week. But I will just say this, these so-called cures, they take you down to trait status, and they do not prevent you from passing the illness onto your children or the trait onto your bloodline. And I just think it's really important that people understand that. There's also bone marrow transplant, and that works like any other transplant. You have to get a donor that matches you. Some people have been successful in haplo, which is where they have half of they're a half match. Some have been successful in the haplo, but usually you want to have a full match to do your bone marrow transfusions. Not transfusions, excuse me, your bone marrow transplant. So, in addition to these, as I said, we deal with this pain from the time we're born. So, as children and into adulthood, we don't just start with the pain medication all the time. We get in our hot tubs at home or wherever, or a sauna, or a hot bath with Epsom salt. Like I said, jacuzzi, heating pads, warm blankets, creams like Tiger Balm or Bengay, Icy Hot. Icy Hot makes like these stone heating pad things. We drink teas and things that will help us with inflammation and sometimes pain. And then there's also medicinal, there's THC. So if you have any more questions, please let me know. Now we're going to go on to the next one.